Welcome back. This is Maggie Mann with Southeastern Idaho Public Health, and today we have a really wonderful health educator here to talk with us about a really important issue. This is Tessa Donaldson, and she is a senior health education specialist with us, and one of the programs that she coordinates is our suicide prevention program. And this is a big issue in Southeastern Idaho and something that we feel strongly about sharing information about and really focusing on prevention of suicide because that is possible. So Tessa, thank you for being here today.
Yeah, thank you.
Yeah, we'll just go ahead and get started.
Okay.
So Tessa, talk with me about how much of an issue is suicide in Southeastern Idaho?
Yeah, so I want to start by giving a little context with starting with the United States and then kind of bringing it down.
Okay.
So suicide is the 10th leading cause of death in the United States, and it's the 8th leading cause of death in Idaho. Idaho has the 5th highest suicide death rate in the nation. So we're the 5th highest state.
Yeah, that's really concerning.
Yeah, it really is. In Southeast Idaho in 2020, there were 45 suicide deaths in our area, and 44% of those deaths occurred within the ages of 25 and 44. So that's definitely a huge population that we focus on because they do have the highest suicide death rates.
Okay. Yeah, that's so sad to me because for many people, that's an age group that they're looking forward to, plans and goals. And for some people, there are just things that crop up in their life that make it hard for them to see the future. And there are so many factors that play into that. In fact, we know that suicide is really complex. So can you talk with us about what are some of the risk factors for suicide ideation and attempts and death from suicide?
Yeah, so, there's no really single cause or a single type or specific person that suicide can affect. Suicide can really affect anyone and everyone, as well as it's really caused by multiple things, including just stages of life, challenges of life that people experience. Now, there are some common things and conditions that may increase the risk of suicide, but it's important to note that just because someone's experiencing one of these conditions, it doesn't mean that they are at risk for suicide. So things like depression, specifically undiagnosed depression, anxiety, bipolar disorder, substance use problems, schizophrenia, as well as physical health conditions, so like pain or terminal illness, any previous suicide attempt, and family history of suicide. So those are all things that may increase someone's risk for suicidal thoughts. However, again, it doesn't mean just because someone is experiencing those conditions that they are automatically at risk for suicide. And people who don't have any of those conditions may still be at risk for suicide.
Okay. So what are some warning signs then that people can watch for in those around them, either family members or colleagues or friends, people they know in the community? What are some of those warning signs?
Yeah, there's a lot of warning signs. We can't possibly go over every single one, right? So I'll just go over some of the most common warning signs. And it's really important to note that warning signs come in context. So just because someone is experiencing or showing one warning sign, it doesn't mean they're automatically suicidal.
Okay.
So it's really important to understand the person, understand the context, understand what that person is going through. But some of the most common warning signs, there's direct and indirect ones. And we'll first go over some verbal ones.
Okay.
And so direct verbal warning signs would be someone saying, I want to kill myself, I just can't go on anymore, you'd be better off without me. Indirect verbal warning signs would be like, I just want out, right? Would be like, oh, you can have this, I won't need it any longer. Pretty soon you won't have to worry about me anymore, right? So those indirect verbal clues kind of hint that maybe they're thinking about suicide and that there's no no future.
Mm-hmm.
There's also behavioral clues, so acquiring a gun, stockpiling pills, a sudden interest or disinterest in religion, putting personal affairs in order, or giving away prized possessions, especially if that's very unlike them to do that. Drug or alcohol abuse, or a relapse after a time of recovery, unexplained anger, aggression, and irritability, as well as really any changes in mood. So this is really important, one, because whenever you notice that someone has some sort of change in mood, right, that could be an indicator. For example, if someone is normally really happy and upbeat, and then they're experiencing maybe more moodiness, sadness, they're very off, right, they're very down, and that's not like them, that could be a sign of suicide. As well as the opposite. Let's say someone has been experiencing depression or sadness, or have just been off recently, and then all of a sudden they're really happy and they feel really relieved. This can also be a sign, because a lot of times when people are experiencing suicidal thoughts and they finally decided that they're going to attempt suicide, they may feel relief and happy because they finally found a solution. So just because someone is automatically happy after a period of sadness, it doesn't mean that they're no longer suicidal or they're thinking of suicidal thoughts.
Okay.
There's also situational clues. So like being fired or expelled from school, a death of a loved one, a loss of someone. Doesn't mean it's a death, just a loss of someone. Maybe the fear of punishment or an unexpected move. Maybe unexpected or fear of loss of freedom.
Okay.
As well as feeling like they're a burden to others. This is a really common one for people who are suicidal. They feel like they're a burden. So they actually feel like their family or their friends would be better off without them. But again, it's important to note that just because someone is experiencing one of these things, it doesn't mean that they automatically are suicidal. It's really important to understand the context, understand what they're going through. And most often people are experiencing multiple signs.
Okay. So if someone is concerned about someone in their life because maybe they're showing some of those warning signs, and the person, at least in their mind, contextually thinks, yeah, I'm worried about this person, what should they do? What steps can they take?
Yeah, well, I mean, the best thing to do is to ask. Just simply ask them. And this can be really scary, right? For a couple reasons. Some people may be scared because of some of the myths associated with suicide. They may feel like if they talk to someone about suicide, that'll increase their risk, or they'll put the thought of suicide in someone's head. And that's not true, right? You can't put the thought of suicide in someone's head. They're either suicidal or they're not.
Right.
As well, it won't increase their risk of suicide. It may also come from fear of what the answer might be. Right? We don't ever want our loved ones to be thinking about suicide. Right? That's a really scary thought, and so that fear may stop us or prevent us from asking. But it's really important that we do ask them and that we don't wait. Right? If we have a feeling that someone may be thinking about suicide, if they're showing those warning signs, it's really important to ask them as soon as possible. And when you do ask them, make sure that you do it in private. You're giving yourself plenty of time to have a conversation with them and to not be judgmental of them. Especially because most of the time when we ask someone if they're suicidal, we'll open up the door for a conversation. They'll start talking to us about what's going on. And we need to make sure that we're not judgmental of their problems and what they're thinking and feeling. Now, I want to briefly go over how to ask this question and give some examples, just because it can be kind of scary and some people may not know really where to start. So there's direct and indirect ways of asking the question. So indirect ways would be something like, are you unhappy? Have you been unhappy lately? Do you ever wish you could go to sleep and never wake up? Direct ways would be very direct. Are you thinking of killing yourself? Are you thinking about suicide? Sometimes when people are feeling the way that you're feeling, they often think about suicide. I'm wondering if you're thinking about suicide, right? Giving a direct or asking directly gives a direct yes or no answer, right? They'll either say yes or no, they are suicidal. Indirect ways of asking may give kind of an indirect answer or unclear answer, right? You could ask someone, have you been unhappy lately? And they could say yes, they are, but that doesn't mean that they're suicidal. Right. So I think it's really important to ask someone directly. And I'll give a little bit of an example like this because it can be kind of scary. And I think that you can kind of use both indirect and direct ways. So let's say I have a friend, let's call her Jane. Maybe I've noticed that she's a little off. She's showing some of these warning signs. I could start by saying, hey Jane, I've noticed that you've been a little off recently. Is everything okay? Right? I'll take a pause, let her answer that question, let her talk to me, and get a feeling of what she's feeling. And then maybe I'll ask, Jane, sometimes when people are feeling the way that you're feeling or going through the things that you're going through, they often think about suicide. I'm wondering if you're thinking about suicide. Right? That's a very direct way, but it's also showing that I understand what they're going through and that it's okay if they are suicidal and they answer yes to that question.
Okay. So, like you mentioned, that can be a really kind of intimidating question to ask someone. So are there resources out there that can help people kind of empower them to have those conversations should they find themselves in a situation where they're concerned about someone?
Yeah, definitely. There's a lot of suicide prevention trainings out there that will actually help them go through asking the question, and then they'll do a little role play with it as well. There's QPR, which is called Question, Persuade, Refer. There's ASSIST training, mental health first aid training. There's also just a lot of resources and videos that you can find. And if you feel like you can't ask the question, you can always practice. Right? Practice on someone, practice on a loved one, a partner, a friend, and even just ask them if you can practice on them, right? Just saying the words, getting those words out can really be helpful when the time comes and you actually do have to ask someone if they're suicidal.
Okay. Well, later on we'll circle back to that and talk about how people can access those trainings and those resources. I want to shift gears a little bit, and unfortunately there are a lot of myths that exist in our culture about suicide and death from suicide. So I'd like to kind of talk about each one, and so I'm going to state the myth, and then you can talk about, is that true, is there some reality to it, or what is the reality around that myth. So the first one, and you kind of touched on it already, but talking about suicide increases the chance that a person will act on it.
Yeah, I did briefly talk about this, and it's really the opposite. Studies have shown that talking about suicide and asking someone about suicide may actually lower someone's anxiety. It will lower the stigma or decrease the stigma around suicide, as well as open up the door for communication. So if you talk about suicide, if you're asking someone about suicide, they may actually feel more comfortable talking to you about suicide, which could decrease their risk for suicide. Also, like I mentioned, you can't put the thought in someone's head. They're either suicidal or they're not.
Right.
You also can't increase someone's risk for suicide by talking about it.
Okay.
I think it's really important that we do talk about it just because it is a very stigmatized topic. And we really can decrease that stigma and lower people's anxiety about suicide by talking about it.
Yeah, I think that's such a great point. I mean, normalizing having those conversations and helping people understand that they're not alone in maybe some of the thoughts that they're having, and that it isn't a permanent thing necessarily. I think those things are really important. So the next one is that a myth that people who talk about suicide don't actually attempt suicide. Can you tell us what the reality is connected to that?
Yeah, so, we don't know if someone is suicidal or not, right? And oftentimes people who talk about suicide really are suicidal. It may actually be a plea for help. They may be talking about suicide because they want someone to see them and they want someone to help them with what they're going through. Now, some people who talk about suicide may not actually be suicidal, but we don't know that, right? So it's really important that we're taking every warning sign that we talked about very seriously, and that whenever someone does talk about suicide, take it seriously and ask them if they really are suicidal.
Yeah, and don't minimize or assume that you know, but just be direct, ask the question.
Yes.
Okay, the next one is, once a person decides to attempt suicide, there is nothing anyone can do to stop them. Or another way of saying that is that suicide can't be prevented. Yeah. What are your thoughts on that?
So, suicide is preventable. It's actually one of the most preventable deaths out there. This myth really discourages people from helping, right? If they think something is inevitable or if they think something can't be prevented, they won't try to prevent it. Right, but most people who are suicidal, they're usually going through some sort of crisis in their life, and oftentimes they feel that suicide is the only solution to their problem. They really think that there's no other solution to their problem. So if we can help them find other solutions and get through their crisis, they often won't be suicidal anymore. Most of the times people who are suicidal, they go through waves of wanting to live and wanting to die, whether it's through a couple hours, days, or even decades. And so it's important that we're recognizing when someone is in maybe that wanting to die wave or that stage, and we're helping them get back into that wanting to live stage, right? Because if we can help them through those problems and help them feel better and help them get through those crises, we can help them get through those thoughts.
Okay.
I also would like to note that a lot of people who have attempted suicide, they have said that seconds after attempting, they've actually regretted their decision, right? So most people who are suicidal, they don't actually want to die. They just truly believe that that is their only solution to their problem.
Okay. Another myth is that only experts can prevent suicide.
Yeah, I kind of want to give a rhetorical question to answer this one. So if this myth was true, right, what would that mean for places like Southeast Idaho where it's very rural? Maybe we don't have a lot of professionals, especially in some of our counties where they may not have any people who are trained in suicide prevention, right? Those people are just left, right?
Yeah.
So really anybody can prevent suicide. Right? Most people who are suicidal, they just need to find hope and help. And we can do that by asking the question and by showing them that we care and helping them find hope, right? We don't need to be counselors or therapists to help someone who's suicidal, right? We just need to see those warning signs and then help them open up to us and talk to us about their problems.
Okay. Another very common myth is that suicide only affects people who have some type of mental health condition.
Yeah, and although mental health or mental illness is common among people who die or attempt suicide, suicide can really affect anyone, whether they have a mental health condition or they don't have a mental health condition. Mental health is not a prerequisite for suicide.
Okay.
So, just because someone has a mental health condition doesn't mean they're automatically at risk for suicide. As well, if someone doesn't have a mental health condition, they can still be at risk for suicide. Now, it is common for mental health to be a factor in suicide, and some of the most common mental health conditions are like depression, anxiety, bipolar disorder, some of those risk factors that we talked about earlier. And it's really important that if someone is experiencing a mental health condition, especially undiagnosed, that they do get treatment, because that would decrease their risk for suicide.
Okay, all right. And then, is it true that once a person is suicidal, they will always be suicidal?
No, that is also a myth, right? And like we've talked about, once someone can get help, once someone who's suicidal gets the help they need, they often won't be suicidal anymore. As well as most of the time, people who are experiencing suicidal thoughts will go through waves, right? Wanting to live, wanting to die. Now, this could mean that they're in that phase of wanting to live for a decade, and then they have the suicidal thoughts, and then they get through a crisis, and then they're wanting to live again, right? So sometimes people may continue to be suicidal, but as they get help, that desire to actively attempt suicide will go down. As well as a lot of times when people do get the help they need, they may not be suicidal anymore.
Okay. A sort of long-standing myth or mindset about suicide is that people who take their own lives are selfish or cowards or weak. Can you talk about that?
Yeah, so like we talked about, people who are experiencing suicide are often going through some sort of crisis, right? Some sort of emotional pain, sometimes physical pain that may be causing some sort of emotional pain. And so they can actually find it difficult to see any other solution to their problem, right? Like we talked about, oftentimes they feel like suicide is the only solution to their problem. And they also feel like their family would be better off without them. They truly feel like they're a burden. So in their eyes, attempting suicide may actually be an act of courage for them because they feel like, one, it'll help with their problems, and two, it will help their family. So it's important to understand that people who are suicidal, they're not weak, they're not cowards, right? They're just people who are helpless and hopeless, and they really truly just need to find some help and find hope in life.
Okay. You talked about earlier about the age group that is really impacted in Southeastern Idaho. A common understanding that a lot of people believe is that teenagers and like college age people are most at risk for suicide. What did the data say?
Yeah, so that age group actually has a suicide rate lower than the national average. And we see that suicide rates actually increase as age increases. So the age group with the most suicides or the highest suicide death rate is about 44 to 65. So kind of that middle-aged group is at highest risk, you could say. However, suicide affects all ages, and so it's important to really focus on all ages and not just focus all of our efforts on that middle-aged group.
Right, and not like if someone in an age group that is not impacted as severely historically, we don't ignore if they are expressing or displaying some of these warning signs.
Yes.
Because each person is a person.
Yes. Suicide, it doesn't discriminate, right? It can affect anyone of any race or any age.
Yep. Okay. Another myth is that barriers to like bridges, safe firearm storage, and other actions to reduce access to lethal means of suicide don't work.
Yeah, so limiting access to these kinds of lethal means is actually one of the best strategies we can do in reducing suicides. Many suicides result in impulsive decisions, and so if we can kind of take that lethal means away, it'll give that person a chance to take time and think before harming themselves. There's also studies that show that people who are suicidal, they often have a preferred method. And so if we take that preferred method away, they usually won't find another method. So one of the most common methods of suicide is firearms. So taking that firearm away when someone may be suicidal would be a really important step in keeping them safe.
Okay. Two more myths to talk about. There are a lot of
yes,
them,
there
as
are.
we talked about. One is that suicidal people keep their desires or plans to themselves, or that it always occurs without warning.
Yeah. So the fact is, about 80 to 90% of people who have gone to attempt suicide have actually expressed their desire and their intent for suicide, specifically in the weeks prior to their attempt or their death. So this myth that people who die by suicide don't show warning signs comes from two things. One is not understanding what those warning signs are, so maybe we don't see them, as well as possibly denying that we see them. Most people, right, they don't want their loved ones to die. They don't want their loved ones to be feeling that emotional pain. So they may subconsciously deny those warning signs that they see in their loved one. So it's really important that we know those warning signs and that we're looking for them in our daily lives.
Okay. And then the last myth that we're going to talk about is that therapy or counseling and medications don't work.
Yeah, so treatment does work, right? When people who are suicidal get treatment, their suicidal ideation will decrease, and oftentimes they won't be suicidal anymore. And like we mentioned, mental health conditions is one of the risk factors per se of suicide. And so if someone with a mental health condition gets help for that mental health condition, they oftentimes won't experience those suicidal thoughts anymore. Now, treatment kind of depends on the person, right? It's really important that if you're looking for treatment that you try different options, whether that's talk therapy or medication, and that you're working with a professional, right? Psychiatrists and psychologists and therapists and counselors, they are trained professionals to help in these situations. They've usually taken several years of training to help when people are in some sort of emotional crisis. So they really are the best form of treatment.
Okay. So Tessa, you've talked a couple of times about the kind of waves of wanting to live and wanting to die. Can you talk a little bit about the concept of safety planning with people who have expressed suicide ideation?
Yeah, safety planning is really important. And what safety planning is coming up with a plan either on your own or with someone else, preferably with someone else, that will keep you safe in a time of crisis. So if you are suicidal, or if in the past you have experienced suicidal ideation, you can create these plans. Or even if you're not suicidal, you can create these plans, because suicide can really happen to anyone. So these plans may include people you can call to talk to when you're feeling that way, ways to make sure that you don't have access to lethal means, resources for treatment that you can go to, as well as maybe safety plans can include what brings you relief, stress relievers, what makes you happy, physical things that you can do to help you get through that crisis. So when we have these safety plans and we're feeling that emotional pain or that crisis, we can look back at it and we can say, okay, I'm not feeling great right now. I'm going to call this person, or I'm going to go do those things that really relieve my stress and help with this emotional pain.
Okay. And are there, you talked about QPR and a couple other things earlier, but what suicide prevention training and resources are available to our people in our communities? Or if somebody wanted to do like a QPR training or mental health first aid, how do they get connected to that?
Yeah, so with the training, on our website, Southeastern Idaho Public Health, under the suicide prevention page, you can find all of the trainings that I briefly mentioned, and they can actually reach out to me and we can schedule them. Okay. So I am trained in some of them, as well as I am connected with people who are trained in some of the other ones that we can connect to get them trained.
Okay, and those, you can do that in any of our 8 counties, correct?
Yep, a lot of the trainings can be done virtually.
Okay.
So really they can do it in their own home. Some of them are an hour long, some of them are like a full day's length.
Okay.
Some of them are a little bit more commitment, but those will go in a little bit more detail.
Okay. And is there a cost to participate in those trainings?
Nope, all of those trainings are free, and we do offer those trainings throughout the year. in groups, and so we'll be promoting those on our website and our social media page that they can sign up for, and usually they are virtually.
Okay.
Yeah.
Okay.
Yeah.
Well, thank you so much, number one, for the great work you're doing in our communities every day, but also for sharing this information. It's so important for people to know and understand. And if you do have questions for Tessa, please visit our website at www.siphidaho.org. And if you or anyone in your life is having thoughts of suicide, there's a toll-free 3-digit number, 988, that you can call and immediately be connected to someone that you can talk with your concerns about and share, and they will listen. They will help get you connected to resources. So please, if you are having those thoughts, please reach out to someone who cares about you, because you're important and you matter, and we want you to stay with us. So again, that's 988. So that's it for today.
Yeah.
Tessa, thank you again. And we'll be back again. Until then, be well.
Thank you.